Hey, everybody, welcome to the TIMGA podcast. My name is Dr. Mohammed Khalif, Executive Director of the International Medical Graduates Academy. And today I'm joined with Marissa Courtney, Licensing Manager at the Washington State Medical Commission, or the Washington Medical Commission right now. And Marissa, welcome to the show. How are you doing? How's your week? Thanks for joining us.
Thank you, Dr. Khalif. I'm very excited to be here. Thank you for allowing me this opportunity to be on your podcast. Week is busy. We are always moving and grooving at the Medical Commission as just processing licenses from day to day, answering questions from IMGs and our just regular applicants as they're gearing to start practice here in Washington. It's
I'm
busy.
I'm super excited, Marissa, and I'm just so happy to have you on the show today. This is our I think so 11th episode of the Timga podcast. So you're like we wanted to have you here for a long time. So I'm just so excited to get your questions because the MDCE license is right now it's famous around the country. We're the first state that's been doing this here in Washington State, and I would say the most successful state, when it comes to actual clinicians practicing and taking care of patients. So, from your point of view, like how many years have you been, working as a licensing manager, and what drove you into this profession?
Sure. So I started with the commission in 2014. Just started as a renewal specialist. I'd worked for Department of Health for a couple of years prior, but knew something special about medical just drew to me. And I slowly but surely worked my way up until about 2020 when COVID happened. I was blessed with this opportunity to be their licensing manager and really have taken this position and turned it into my career. I'm actually almost graduating from a healthcare administration college program to support to this, so I can be a bigger and effective help to this
That's amazing.
profession.
Congratulations.
Thank you. So with that, I've been with the commission for this long, and the MDCE license was actually my very first license to create on my own. So it always has a special place in my heart. So I'm glad to see it bloom after 5 years of its existence and just the steady success that it's been having over the years.
That's amazing. That's amazing. And for those like people, maybe we do have some IMGs that listen to the show, but we also have like some advocates and people who are not familiar with different medical licenses, like people like who run nonprofits and want to help IMGs. So can you give us a little bit overview of what the MDCE is,
Of course.
and just a little bit history behind it?
Sure. So we first implemented the MDCE, or the physician and surgeon clinical experience license, in October of 2021. And it is basically a pathway for our IMGs to be able to practice clinically in Washington State. They are within the same scope of practice of a physician. The only just small difference in that is that it requires nomination from a hospital or facility and requires supervision. But there's so many different changes that have happened over the years to improve this license, and it's just been such a great opportunity to be able to allow a pathway for our IMGs who haven't been able to practice clinically in the states to now do so and do so effectively.
Yeah, that's amazing. And you said like you're the first person who created the license, so that was amazing. What was that like? I know maybe you cannot tell us everything, but what was that process like?
It was as my first. I was learning on the job, especially being 1 year into just being the licensing manager. So it was a lot of responsibility, a lot of handling with care. And you and I worked a lot during this initial process, and it just took understanding the true need and using that to drive um the purpose behind it. So I wanted to make sure that this license was ready to go so that our IMGs could actually work and be a help, especially during COVID. It was huge. It needed to happen, and that was the perfect time for that to be implemented.
Yeah, yeah, that's amazing. So an IMG, like let's say they wanna, they wanna basically come here and maybe they live in the state, maybe they live out of state, and they want to practice in Washington State. So the first thing they need to do is get a job offer. Is that what it is?
Yes. I would recommend it. It's not a requirement to apply and not have anything set up, but it does hold up your application if you don't already have an offer in hand. We used to back in 2021, and I believe until what was it, 2025 or 2024, that we removed that requirement. You used to have to be a resident in Washington for at least a year. Thankfully, that has been removed, so it allows any IMG in the country to be able to come to Washington and obtain this license without that time restriction as a resident here. But I would suggest, if you are wanting or interested in applying for this position, get a job offer first, and then seek the license.
Yeah, and like for those who are listening, and if it's hard for you to find a job offer or you need some consultations, you can always reach us at timga.org, and we can try to help you the best way that we can. So, and I know a lot of people ask me this, and hey, can the medical commission help me find a job? So, can you touch on that?
I wish, and we have, unfortunately, not unfortunately, but we have sent a lot your way. I wish we had an avenue for us outside to help, but we have to stay pretty neutral. We just handle the application. But no, just seeking resources on your own or with Timga will truly help your success. But unfortunately, the medical commission cannot refer you to any facility.
Yeah, that makes sense. And also, when people go, okay, they want to apply for they see the applications on the WMC, and and like there's two options. There's like a paper option, and there's like a like online portal option. Can you explain a little bit about those, and like which one is the most easiest for people to complete? And yeah,
Certainly. So there are two options to obtain this license. You would need to either download our paper application and mail it in with the check or money order, whichever is preferred method for you, or you can apply online through our website that will connect you through HELMS. And this right now is the preferred method. Now, we may run into some situations where HELMS is not available, so you may have to resort to the paper application. And if you choose paper, that is completely up to you. But to set up success for you in the future in Washington, I would at least create a HELMS profile, because that is where our communication is coming from, along with where you'll have access to a receipt if you ever need that for reimbursement or tax purposes. You will actually get your license there. Once we grant you the license, it will not be mailed to you, it will be accessible through the portal. And your renewal notice, when it's come time for renewal, will be a notification through that portal. So while paper is great and we like to be able to fill out something with pen and paper, the preferred method would be to go online and actually do a HELMS profile and apply through there. It just
yeah.
makes things a little bit more streamlined.
Yeah. So, and when people click on the Helms profile, and I think so they're redirected to securewashington.gov, right?
Yes. Yes.
Uh,
So you would need to create your own Secure Access Washington account, and then it will prompt you to add a service, which you will select through the Department of Health, and it is the Helms link.
yeah,
Now, I will preference at the time of this recording, we cannot make any edits to the application, so there are information in there that is a little outdated. But I would say, if you're asked about providing a driver's license or state registration or proof of residence in Washington state, just go ahead and just select yes, just because we are in the works of changing our online application, but there's just a little lag in that processing time. So for that information to be switched. So I would say, if you're right now in February looking to apply for the license, just go ahead and bypass that by clicking yes, and then we know it's not a requirement internally.
Yeah, and yeah, I've gotten a lot of emails about, that, like, so many questions like that you mentioned. Also, can you talk a little bit about, the mistakes that people do when they, get into the HELMS? Is it like, and I've seen like some people who have applied to like a full physician licensure rather than the
Yeah.
MDCE licensure. Can you talk a little bit about that and how to kind of avoid that?
Yeah. So just, there is a lot of um there's a lot of different options when you log into Helm. So just coming when you're logging in, just know exactly what you're looking for. Um, some of the names or terminologies may not be the same, but I believe what we have online is physician and surgeon clinical experience license, or there may be a limited clinical experience license. I apologize for not knowing that strictly offhand. But just knowing that forefront, if you're looking for any of the terminology, clinical experience is what you will want to select. We do have just a regular physician and surgeon license, or we do have residency and fellowship licenses. You will want to steer clear of those. However, if you do, please notify us immediately after submission that you have made the error of selecting the wrong application. Now, if you select the application and you're filling it out and you realize this isn't the right application, pause, don't go forward. If you go back to your Helms portal, you can actually delete that application and start over with the correct one. So
Yeah.
there is a couple of opportunities to stop it, but if you happen to go all the way through, just notify us at the licensing unit, and we'll be able to walk you through next steps to get that transferred over to the correct application.
Yeah, that's amazing. And a lot of IMGs sometimes they ask me, they get confused a little bit about Helms, and I try to give them the documents that you guys have, the frequently asked
Mhm.
questions document. I think you guys have like a step by step document as well, which is
Mhm.
amazing. Does the medical commission kind of have plans to maybe create video tutorials in the future to help IMGs to navigate that process?
Yes, that is our goal. Again, when there's been different stages with our new Helm system. So until everything is solidified with this is the correct pathway, we will eventually turn into actually having video walkthroughs available as well as PDF.
Yeah, that's amazing. That's amazing. And when people a little bit about the fees. So like let's say somebody I some questions I get sometimes is like sometimes the person is wants to maybe get their license a little bit sooner, so they will apply a little bit sooner, and then they'll wait for the job offer later, so they'll do the interview so they can start with their employer quickly. So but they don't wanna pay the fees up front. So is the fees required upfront, or can you pay it anytime through the process?
So, in order to do it online, the fees are upfront. Now, that is a benefit towards paper. If you are wanting to apply and just actually have it pending, but haven't fully committed to sending in payment yet because you're not sure if you were able to get a job right away, you
Yeah,
certainly can fill out the application. We will have it pending up to a year,
okay.
and then you can decide whether or not if you were able to find employment, and then you can continue the application process by sending in that payment and fulfilling the other requirements. But if you're going to do it online, you will have to pay up front in order to proceed with the application.
Yeah. Sometimes I get people that question, and, so because people are like, "Hey, I don't have the fees because
Yeah,
I don't have a job yet, I can't pay for the fees."
understandably. Yeah.
Yeah, yeah. So can you talk a little bit about, you know, like maybe like reasons why we talked about that reason, maybe applying for the wrong licensure. Any like reasons that you see that people make mistakes or maybe delay their process?
I think the in the beginning it was just a misunderstanding of what this license was, or there was assumption behind um I can get this license and then get employed, but that's not the type of license this is. It requires a nomination up front. So we run into, or we have run into in the past, providers applying, not having success finding a employer to sponsor them and having to pull out their application. Now, there have been times where the provider has already paid up front, and those fees are technically non-refundable. We have made certain we've made it's all case by case, but we would either, depending on the situation, either refund that
Mhm.
payment, or we may close your application just due to the length of it and then maybe waive your application fee in the future. It's really case by case. They're technically non-refundable, but we do tend to see if we can assist, especially where there is that misassumption between you applying for the license thinking you were going to get employed, or you were not able to get nominated
Yeah.
somewhere.
Yeah, and for the nomination process, um, so the IMG has to speak with their employer to submit the nomination. And that's through a separate email directly to, I think so. It's medical licensing, right? At
Yeah,
Washington.
medical dot licensing. Yeah.
Yeah. So that's the email that they send it to. And so should basically, is there like and we have a template on Timga that Marissa shared with us. So if anybody wants to reach out to us, we can provide that template for your employer. But Marissa, is there like is that template like on the website for people maybe who wish to check the medical commission directly, or I
That
don't
is
know.
a great that's a great thing. I do not believe we do. I certainly can see about adding that if that's not on there already.
Okay.
But that is readily available if anyone wants to contact the licensing unit. We have that available, but I will certainly look into adding that if that's not already there.
Yeah. Awesome. Sounds good. And last thing, when it comes to the practice agreement, what are the has practice agreements ever been declined, or is there like a right way to do it? Like, what should people like who are maybe speaking with their employers, because a lot of IMGs are actually advocates for these new licenses as well, because they're educating their employers on, hey, what is this and on that, and I think so. A lot of employers have experience with a PA license, so it's pretty much the same, right?
It's pretty much. I mean, the difference is you're supervising an MD instead of a PA, but the structure, we took that format and just applied it to the MDCE license. We have an online portal that allows you to actually fill in the information, and once it's submitted, the MDCE or IMG will actually receive a copy via email along with the employer who filled out the form. So everyone will get a copy once it's submitted. It's submitted to the medical commission for review, but thankfully, in the last 5 years, almost 5 years since the existence of this license, we have not had to reject any delegation agreements or
Okay.
practice agreements.
That's amazing. That's amazing.
Mhm.
Right now, Marissa, I want to move on to questions I get most of the time with regards of changing employers. I mean, a lot of people reach out to me like, "Hey, I already have a license. I want to change my employer. How can I do that?"
So we've had this come up frequently in the last few years as the positions have grown and opportunities have opened up. There's two options. So, or we've seen two cases where either an IMG decides that they are able to move on to a different opportunity, but there may be a slight gap in between. We have either had them submit a new practice agreement and a new nomination letter that will allow them to transition their license to the new sponsoring practice without any gaps in their license. Or we have had in a couple of instances too where there is an extended time between leaving one employer and getting another. Unfortunately, with this type of license, it is a time-based
Mm.
license. So it is when you are granted a license, it's 2 years from the date that the license was issued. Now, if your license becomes expired or you transition for employers, that time doesn't stop.
Mhm.
So, unfortunately, we would terminate the license in regards to making it expired the date that you leave your current practice. And then when you transition to a new place, that's when it would start up. But that time, unfortunately, still had to continue. So if there's a 6 month break in between employment, that 6 month isn't added onto your expiration date. It's already included in there. So keep
Okay.
in mind if you are wanting to change employments or have different opportunities, keep in mind when your expiration date is or that lapse in between, because that could hinder your time with this license for right now.
Yeah. So, let's say, like, if I'm even like if they work with the same employer, like, let's say somebody goes on maternity or paternity leave, that time is still like it's still counted towards the full time.
Yep.
Okay.
Hmm.
And and so that's the process. They submit a nomination letter, a new nomination letter, and a new practice agreement. And which leads me to the next question, which is kind of related. Is people a lot of people ask me, "Hey, can I have two employers at the same time? Like, can I have multiple nomination letters?"
No, unfortunately, the way this license is created is strictly you are nominated to one area, and that's where that license lies
Yeah.
until you move on to someone else and have a new nomination. So, unfortunately, for the time being with this license, you're only able to be with one employer.
Yeah. And is there like new fees associated to when the people are switching employers?
It just depends. So again, if you had let your license lapse for an extended period of time and maybe it came time to close to your expiration date, you may be required to just pay your renewal fee.
Yeah.
But to switch, no, there's no fee.
Yeah. Awesome. And so that's most of the questions I got from the MDCE licenses, and so excited to see if people have more questions. If you guys ever have more questions, send us an email, and we can do a part two podcast with Marissa sometime.
Yeah, I would
Uh,
love.
But Marissa, I want to move on to the exceptional qualifications waiver
Oh,
that a lot of IMGs ask me about, and I think you work on that too as
I
well.
do.
Yeah,
Yes, that was another project of mine.
yeah. Can you tell me a little bit about what that is? I know it's not for every IMG; it's for like specific types of IMGs. How many licenses have you approved in the past, and what is the process like?
Sure. So that was something, the exceptional qualification waiver was something we implemented, I believe, at the end of 2022, beginning 2023. I apologize. These dates kind of run together with production. They do, but it's been around for a few years. It wasn't advertised a lot just due to we wanted to keep the focus on the MDCE license. If we had that pathway available, we wanted to make sure that they could get that without confusing anything. But it allows IMGs who have been exceptional in their field to bypass the 24 months of AC, sorry, ACGME accredited postgrad training that is a requirement in Washington State for licensure. So let's say that they've already completed medical school in a different country, are ECFMG certified, have taken all three steps of the USMLE or Flex or NBME, whatever you took, and you just have not completed 24 months of postgrad training, ACGME postgrad training in the US, and you have perfected things in your medical field, you may qualify for the exceptional qualification waiver that allows us to waive that requirement for licensure.
Yep.
So we have it's like a three different pathway waiver that allows you to either state that you have medical excellence, you were a excellent employee, or you've had excellence in research. the 3 different pathways, and you would just submit 3 different letters of recommendation from peers or higher in your field. And then you would also submit proof of that excellence. So we receive a lot of publishes. We've seen grants. We've seen what other things have we seen? Patents come through.
Yeah.
It's just been incredible to see the different
Wow.
IMGs that are coming through that now have this opportunity to be fully licensed in the state. I think I've had the honor of licensing at least 25, maybe
Wow.
30 IMGs in the last couple of years. I just
Yeah.
approved 2 more
That's
last
amazing.
week. So we have it's been getting a lot more traction as the I guess the word has spread
Yeah.
that we offer this, but it's been a great opportunity, and I'm just s- surprised and amazed by the excellence that have come through with these waivers.
Yeah, yeah, that's amazing, Marissa. So if people wanna, contact the medical commission, whether they're like maybe like a nonprofit, um, and or like an IMG or an employer. So what's the best contact information? Is it the medical
Yes.
licensing?
Yes, please. And yeah, as of right now, the exceptional qualification waiver is not advertised on our website, but it's we provide the instructions upon request. So if there's anybody who is interested in obtaining that, just please email medical.licensing@wmc.wa.gov, and we're happy to send that information to you.
Yep, and we'll include, that email in the show notes as well. Um, Marissa Courtney, licensing manager at the Washington Medical Commission. Thank you so much for joining us, Marissa. We really appreciate your time, and I know a lot of IMGs are really looking forward to this episode.
Thank you. Appreciate it.
All right, have a good day.
Thank you.